I'd like to introduce Dr. Patrick Callas from British Columbia in Canada. Thank you for joining me, Patrick.
Thank you for having me.
Could you tell us when you first heard about LDN?
Oh, that's a good question. When did I first hear about it? I began my practice before I set up here on Salt Spring Island, which is a little Gulf island off the coast of British Columbia, working in Victoria, which is the capital of the province, with Dr. Neil McKinney, who's a naturopathic doctor who focuses on cancer care, or supportive cancer care, and I would have heard it from him. I can't remember if it would have been in his class that he taught me in third year when I was in naturopathic medical school, or if it was directly in practice with him, but it certainly came on my radar even before I graduated school, so I guess it was before, yeah.
And when did you first start to prescribe LDN?
For us, for naturopathic doctors in BC, we have our prescriptive license is a postgraduate option for us. So I would have got my prescriptive rights, I believe it was around June of 2013, and I probably was prescribing it within a month or two after. I have to check my charts, but I'm pretty sure by July or August, so shortly after, was probably one of the very first drugs I prescribed.
Mm-hmm. And what experience have you gained in prescribing, as in, what conditions, what reports your patients have given you on their treatment?
Mm-hmm. The context, like I said, was I knew of it as a cancer support, an adjunctive therapy based on some of the research. For most forms of cancer, really, it's worth adding in. So that was where I first added in. And it's a little hard to evaluate the response, although you can look at some trials. They're pretty remarkable with very few other treatments. But for the most part, in naturopathic oncology care, we have a lot of remedies we use, so it's always hard to say which is doing which. But the first really striking case of it by itself is I had a patient with ulcerative colitis come in, anorexic, was losing more and more food just because their gut was so wrecked, and they're getting basically allergic to everything they were eating, and their diet was rapidly shrinking, and they tried everything else, natural and drug, and they were basically desperate, which was heartbreaking. And the only thing they took at first was low-dose Naltrexone, because they felt like they tried a whole bunch of sort of the other natural remedies that I'd recommended. And within a month, their digestion started to settle down. They started to put on weight. Within less than 3 months, they'd start to introduce food back in. They hadn't eaten in 2 to 3 years or more. And last time I heard, happy, healthy weight and eating much closer to our normal diet again, which was remarkable because they're in a state of decline. So that was the first really striking thing that I'd seen, and just sort of reading about it and studying a little bit about it, I had lots of questions for people around me before at that time about, well, given the mechanism and actions it has, is it going to work in things like chronic Lyme disease or other tick-borne illnesses, which I was starting to see a bit of, and I see quite a lot of on the island here, to my surprise initially. What was the other condition I was thinking of too? There's something else that I'm trying to think what it was. I'll have to come back to me, but there's a couple conditions that I was really curious about. I think thyroid too, which I was very happy to see answered at the conference in Vegas about its use for thyroid condition.
We've found that many of our members have got Lyme disease and are doing quite well. I mean, how do you go about treating Lyme disease?
That's a whole topic of discussion on itself, an evolving one. I didn't set out to treat it, although I was aware of it and knew that there's a need and complexity around it. And my own treatments have evolved. I am a member of ILAS, the International Lyme Associated Disease Society, which I just officially joined recently. I was in Banff, Alberta, for their conference. So I mostly follow their protocols, but being a naturopathic doctor, I certainly have a wider perspective than antibiotics and prescriptive medications to balance out the other pieces of the puzzle. There's quite a few herbs that could be used as antimicrobials as well as immune boosters themselves. And I always now prescribe low-dose Naltrexone for anyone who's willing to take it, because I've seen some pretty remarkable improvements. I wouldn't, again, it's an adjunctive or add-in therapy, but it can be pretty important. Really emphasized to me a member of the Victoria Lyme disease group who I've gone and spoken to a few times. I'd recommended them. Now they're seeing another doctor who's sort of the expert in BC named Dr. Eric Chan, and it wasn't really on his radar. And I said, oh, maybe you should try it out after actually going to the LDN research conference in Vegas virtually, and it was mentioned there too. So piqued my interest, and I started to prescribe it and seen some promising results. And so I recommended this woman who's part of the Victoria Lyme support group. And I went for a talk recently, and she hugged me because she said she'd never slept so well in years. She was actually waking up laughing in the previous state of insomnia, and her pain went down by 70%, and she said it was remarkable. So that was pretty amazing for me to see. And in my own practice, I've certainly seen increases in energy, better immune function, a little bit better responses to any of the therapies, whether they're, antibiotics, herbs, or anything else that's working on the Lyme bacteria. So I think it's a really helpful adjunctive therapy to add in for them.
Mm-hmm. And do you prescribe it for MS?
I've only done so. I've only had the opportunity to do so once. It was a really advanced case where they're in a wheelchair and lost most of their mobility, and they gave it. I think they gave it 3 months, and there wasn't any marked response. It was very early on with my prescription of it, and it was the son, the mother had convinced her to take it, and she'd done so somewhat reluctantly. So I don't, in retrospect, I mean, maybe it wasn't going to work for her, but I kind of wonder if a longer trial or even going up the 4.5 milligrams may have seen a response. But certainly, given her state in retrospect, I think she needed a lot longer trial. And of course, the skepticism and my son's making me do this sometimes doesn't help our situation a little bit as well. So that's the only opportunity I've had in that case. The only other case of MS I've treated so far in my career, I diagnosed as a misdiagnosis because they had significant tick bite history, and treatment with antibiotics as well as dealing with a heavy metal burden has greatly improved their supposed MS symptoms. So I did use low-dose Naltrexone with them, and although it may improve some of their energy, they had some pretty severe reaction to it with sleep and sleeping. It made them really fatigued during it, which was curious.
We found that of the doctors that I've interviewed, and I've interviewed many now, that if pushed, they say that most patients notice something by the 4-month mark. From surveys that we've carried out as the LDN Research Trust, there are some people who stabilise, and if you've got a progressive disease, to stabilise is good. And some people have said, after 15 to 18 months, I don't know how and why this works, of being stable and feeling okay, but have had no symptom relief, suddenly they start to get symptom relief. So purely on that basis, we always suggest to people, it's not going to do you any harm, and if you don't think it's doing any good, at least give it, 18 months before you say no, it's not working. And the number of people who have stopped taking it after 18 months, I would say half of them go back on LDN because they find they're not sleeping so well, they're not feeling as good, and because they had improved over a slow period of time, slowly, they hadn't noticed. It's only when you stop and you go back to where you were that you think, well, hey, wait a minute, actually it was doing something for me. But obviously not in that lady's case, because she'd only been taking it for 3 months, which I don't think possibly was long enough to notice anything.
No, I don't think it was for lack of efficacy of the low-dose Naltrexone. Like I said, early on, so probably a little bit timid and not fully aware of the length of time, and they were looking for a response, within a 3-month window, which none was evident. I mean, it is possible that there was some slowing of her progression, which would have been hard to monitor at that time, given where she was at. But that's really, thank you for sharing with me. That's really profound to know, and I'm not surprised that, given that it's sort of that slow, subtle improvement for some people that they don't really fully notice, because that's just a challenge in medicine, especially in natural medicine, where some of the remedies are a little slower acting, and you're really reverse engineering these chronic illnesses where you're not going to see an improvement in the next week. Some people that they have remarkable improvements right away, and that's what everyone always hopes for, but really sometimes it's that slow, gradual progression that's a little harder to monitor, but can be really profound if you kind of have that retrospective look, or like you say, you remove it and you notice the difference.
Yes, exactly. And I found myself, I've got MS, that as I was going downhill, I could notice something I could do one week I couldn't do the next, and it was horrifying. Every tiny thing that you couldn't do anymore, it was just like, oh, I'm going down further. But once I started to improve, it wasn't every little thing that improved that I noticed, because you just forget, oh, you can do that now, and you don't think, I couldn't do this before, but I can do it now. It's amazing, isn't it, how the mind works like that, where when you go downhill you notice it, but when you improve it's not always as easy to remember, apart from when you're in a wheelchair and you get out and walk. I mean, that's
yeah, well, and I
quite
think
a big thing.
Yeah, maybe it's a little bit human nature, and I think there's a real lack, and there's actually a discussion I was having with some very, very intelligent, high-level patients, like real brainiac patients of mine not too long ago. We were talking about that problem of symptom monitoring, which is a whole other topic, but very interesting one, that, a real way to monitor. And, there's some ways now, and doctors have, forms or electronic forms where we can measure some of them, but I still think they're somewhat inadequate to really, monitor some of this, something that's slower like this, or that maybe can be a little more subtle over long periods of time. At least maybe there's things out there, and someone's going to point them out to me, and I'll be grateful for that.
Well,
I feel like there's nothing that I'm aware of right now that is adequate enough to really monitor some of these things, aside from the low-dose Naltrexone app.
Well, this is what I was going to say. With their app, you can track your diet, your supplements, your LDN, your other medications, sleep, quality of life, pain levels, just about everything that you can do, and keep a journal, and you can print out graphs and charts and all sorts of things. So, and keep a journal. So everything you need to do, you can actually do it with the app. But if there's anything that you find isn't on the app that you think should be, we're developing it all the time, so anything can be added.
Mm-hmm.
So
yeah, I totally escapes my mind, and I guess for some of those patients now, the more using low-dose Naltrexone, they're cancer patients. But in saying that, I realized, well, they could still use it even if they're not necessarily using low-dose Naltrexone. And of course, they do use it with cancer patients, but these ones weren't for various reasons. So,
well, okay.
Good point. It's so easy to use because so many people have, smartphones, and it's so easy to track that way.
Yes. Well, not only on smartphones, you can actually use it on a PC or a Mac or a Kindle, and they're all linked. So if you've got a phone and you want to, you've got some time to kill and you're writing in the diary, it then is transferred to all your other electronic devices as well. So that's quite a handy thing. Now, if there are any people in around British Columbia that would like to see you for a consultation, how would they get hold of you?
They can get a hold of me in my clinic, which is called Island Natural Health. The phone number here is 250-537-0035, and they can always call and set up a phone appointment. I do like to see people face-to-face when possible. However, if they're coming from far and wide, I am set up to use teleconferencing with Skype or FaceTime for the Mac users. So there's some different options there, but I'm always happy to hear them over the phone. For first contact, too, they can also send an email to us. The email address here is info, I-N-F-O, at islandnaturalhealth.ca. So those would be the two best ways to get a hold of us. And they can also check me out or get those contacts on our website, which is just www.islandnaturalhealth.ca.
Okay, well, thank you very much for sharing your experience with us.
Well, thank you very much. It was a pleasure to talk to you today.